Okay, thank you everyone. The moment has arrived and we are here to have our informational webinar for HIV is not a crime awareness day. We have some housekeeping I'd like to get into before we start our conversation. We have language interpretation in Spanish, and we will take just a moment to go over the instructions for that if you need that. The first slide is in Spanish for those that need to be prepared. For those on the English side, sorry if I'm going backwards, Jose. Big thank you to Jose Romero for being our interpreter today. Um, you'll click on the interpretation globe at the bottom right-hand side of your Zoom screen. You'll select the language that you need it in. And if on your smartphone, it'll be in your menu with the three dots. You'll tap more, you'll see language interpretation, and then you'll select your language. And I just also want to thank the Tilde Co-op for their language justice support for Sero Project webinars. Thank you so much. A few other last minute housekeeping items. This is being recorded and streamed on Facebook Live. Please feel free to share from your own Facebook accounts. The slides will be made available after, as well as the recording link, after we complete our discussion today with some other materials that we'll be talking about later on. If you'd like to share in the conversation, please, as some already have, introduce yourselves in the chat, name, pronouns, location, what brought you here today. You can also use the Q&A feature to ask any questions, especially if it's something you would like to direct to one of the panelists so it doesn't get lost in the chat feature. The Q&A helps us separate questions that we need to uplift. Also, feel free on Facebook Live to drop your comments and questions and tag the Sero Project, and we'll see your question and try to get to as soon as possible. I'm also wanting to let folks know that this Awareness Day does have a hashtag, and as you're sharing that you're with us today for this conversation, please use hashtags HCAD22 for HIV is not a crime awareness day, and also our theme of strength, engage, reform, and overcome. And we'll talk more about that as well. For those who may not know me, since I have been talking this much so far, I am Kamaria Laffrey. I am a woman living with HIV for 18 years. I'm also living with Black Girl Magic and chronic optimism for 39 years. I am the program director at Sero Project and so happy to bring this information to you all today for the HIV is not a crime awareness day, and I will be your moderator for the discussion. I also want to take a special moment of gratitude to not just those that have made today possible, but to all of you in the community that are joining us, our state networks, our coalitions, and organizations that have been a part of the HIV is not a crime training academy, the Health Not Prisons Collective, Sero Project Justice Institute participants, and of course, our friends at the Elizabeth Taylor AIDS Foundation. I'm really, truly grateful and want to thank you all for your tireless work, your victories, and your commitment to press forward. This inaugural kickoff really is for you. A little background to why this day is significant and why this day was chosen in particular. And this day doesn't mean January 31st, but the February 28th date. This date was chosen to respond to the need for alignment in communities between various stakeholders to stand in unity against the harms and violence of HIV criminalization. Joint efforts that you've all taken part in, like the partnership of the planning organizers of HIV is Not a Crime Training Academy, which you see here on the screen is Sero, PWN, Positively Trans, ThriveSS, and the US People Living with HIV Caucus. And also our Health Not Prisons Collective, which we'll hear more from in a moment. And other spaces supported and resourced to respond to design initiatives such as the Project Justice Institute that support grassroots efforts and advocates that are leading the efforts in their state and coalitions to end HIV criminalization. This specific day also ties a symbolic bow to the close of recognizing National Black History Month that houses National Black HIV/AIDS Awareness Day, which is on February 7th. This also intersects into National Women's History Month, which starts in March. These two demographics, women and Black communities, are disproportionately impacted by HIV transmission rates, and even more so in states that enforce HIV-specific and general laws that criminalize HIV. Black Americans make up 13% of the United States population, 40% living with HIV, and 33% are incarcerated in jails and prisons throughout the nation. This is not even taking into fact those that experience the threat of criminalization but never are arrested, and the oppression from systems that uphold criminalization. The numbers are showing that Black communities, my community, cannot end the HIV epidemic until the laws that criminalize a person's HIV status are changed. This day is also a symbolic nod to the legacy of Elizabeth Taylor on what would be her 90th birthday, which is actually the 27th. She was someone who held a tireless commitment to bringing awareness to HIV/AIDS globally. So in 28 days, this day is yours to make it what you need for your community and to push the needle forward and mobilize in your local networks, your state, and whatever space in your community you see fit to declare that HIV is not a crime. And now we're going to get into what everyone's been waiting for, which is what I'm excited for. I also want to I've said it, I think, a few times as we did our check-in, but just how immensely grateful I am. And I've been waiting for this moment for weeks. I'm honored to introduce you to today's panelists, leaders, change makers, survivors, and fearless friends. We have Malcolm Reed with ThriveSS. We have Wahida, the legend, Shabazz L. We have Nick Malone Ruiz, and please correct me if I pronounce your name wrong. And we have on docket Andre Leaphart, who may have a conflict in his schedule and might not be able to join us today, or might be lost in our panel, and I haven't brought him into the room, just acknowledging that I'm juggling a lot of things right now, and I would try to see if he's there. And then also we have Tim Mendelson with the Elizabeth Taylor AIDS Foundation. Malcolm is the director of programs at ThriveSS, where he leads as founder of the Silver Lining Project and co-author of the Silver Skills curriculum. He's co-founder and co-director of PASAN, which is the Political and Social Action Network, and also represents ThriveSS on the US People Living with HIV Caucus Steering Committee, and also sub-chairs our policy arm from that committee, and represents County District 2 on the Fulton County HIV/AIDS Care Prevention and Policy Advisory Committee. Wahida Shabazz L is an African-American Muslim woman and retired postal worker who was diagnosed with AIDS in 2003. She is a founding member of Positive Women's Network USA and serves as a board member for the AIDS Law Project of Pennsylvania, where she is amazing in all things that she does. She also serves as a steering committee member for U=U, and advisory board member for Sero Project. She is employed by Philadelphia Fight as its Goodwill Ambassador and is a longtime member of ACT UP Philadelphia. She's currently serving as the interim program coordinator for Health Not Prisons Collective and is also the director of community engagement for the Reunion Project, where she is leading an HIV long-term survivor alliance. Nick Malone is living with HIV, and while he may sit on a number of boards and log on to webinars at a moment's notice, as he did today, despite knowing all the acronyms and all the things that you need to be an advocate and receiving plaques of recognition, they've grown tired of the token consumer and are ready to apply their untapped potential to HIV advocacy sector. Nick's participation in the Sero Project Justice Institute has given him the platform to do just that and focus on multiple intersectionalities that are impacted by HIV criminalization laws. And I'm not sure if Andre has joined us, but I will read his bio as well. Andre Leaphart of Virginia has had a busy professional life as a counselor and minister until he lost everything at the age of 40 as a result of being criminalized by his HIV status. He had never been charged for anything in his life until that point. Today, through many platforms, including the Elizabeth Taylor AIDS Foundation True Not Crime series, Andre shares his story to help others avoid his unfair experiences with the criminal justice system and HIV stigma, and has dedicated his advocacy work to improving the lives of people living with HIV, and hails from the state that just reformed their laws during a pandemic. And lastly, we have Tim Mendelson, who worked as Elizabeth Taylor's executive assistant for more than 20 years and currently serves as the co-trustee of her estate. Per her request, he personally witnessed Elizabeth's passionate drive to help people affected by HIV and AIDS with an immediacy that she felt was crucial for this fight. Today, Tim remains dedicated to keeping Elizabeth's voice and spirit preeminent in HIV/AIDS activism for the purpose of ensuring it is at the forefront of current actions concerning this global pandemic. I'm seeing that someone raised their hand, but I lost.
Julie Patterson did.
I'm not sure if folks are doing that by accident or if they're reacting. So for now, if folks could please use the chat or the question answer feature, and then we'll have an opportunity for folks to come off mute and raise hands at the end. I apologize for not clarifying that during the housekeeping section. So now to get into the discussion, and I can talk a little bit less. Clients that you serve and see through ThriveSS and other reform efforts through the Georgia coalition that you work on. How is partnering with this Awareness Day supporting the efforts that you serve through ThriveSS and the coalition?
Good evening, Kamaria, and thank you for having me. ThriveSS is an acronym. It stands for Transforming HIV Resentments into Victories Everlasting. The SS stands for Support Services. We support same-gender loving, mostly Black men, but overall the entire community who are living with HIV and or who are at risk for contracting HIV. We know that stigma is one of the major barriers to people getting into care and staying in care. And we also know that there is a direct relationship between these criminalization laws and stigma. So when we talk to the men in our group, we have asked them, did you know that you could go to jail if you are accused of not disclosing your HIV status to a sexual partner? And many of them don't. So this Awareness Day is extremely important because we have to get the message out there that this is happening. We are making progress in the state of Georgia to get our law changed. Last year, we came this close. And at the end of the legislative session, there was, a couple of little wranglings, if you know anything about how legislative sessions go. One senator wanted something from another bill added to our bill, and therefore that our bill did not go through, but we're going to work through it this year again. The bill will be reintroduced and we're going to let it go as is. But the main thing is that we have to let the community know that the law, first of all, the law exists. Atlanta is a hub. People come to Atlanta from all over. And especially young Black gay men who may have, come from the rural South or wherever, where they weren't comfortable living their lives. They migrate to Atlanta. And a lot of them aren't aware of the law. And so we have to make sure that they become aware. And we don't want to get into a situation where people are living their lives out in the community, and then they find out that this is the law. And so they go back and they say, well, then if that's the case, I'm never going to get tested, because if I don't know, then, they can't say that I did this deliberately, or whatever the scenario. When you have a law like this, you have to think of all angles, and you have to think of all the possibilities how this law is doing harm. And since the law does not take into account the science, it does not take into account U equals U. It does not require proof of transmission at this point. We know that this law is just unfair. And, you're asking people to disclose their status, to disclose their personal health information to people when there's technically no reason. If you can't transmit, if you are on medication, and we have a very good record, 94% of the men in our that are in our network are virally suppressed. And so having to reveal that when there is no chance that you are going to spread the virus to a sex partner or anybody else, just makes no sense. And so that's what we're trying to do. We're trying to make sure that people are aware of the law. So we're hitting it from a legislative perspective in getting the law changed, but also from a public relations perspective, and trying to make sure that everybody is aware that the law does exist. And when it gets changed, we'll let them know that too. But right now, the law is on the books, and it is endangering a lot of people.
Thank you, Malcolm. I really appreciate you highlighting that even when the laws change, the education is still needed. I think that's something that we're starting to see, or have been seeing for a while, with as many states that we have. I think there's 10 states now that have changed their laws in some capacity, with Illinois being the one of the states that repealed. There's still education that's needed. Just because the governor signs a paper doesn't mean that the community is not automatically aware of the changes that have been made. And we're seeing that the education is needed as well, because folks are still living in stigma and fear of other systemic issues besides these laws. But I think we'll get closer to chiseling away and eliminating stigma and discrimination when we change these laws, when they're gone. So thank you for highlighting that's Georgia's pathway. I want to turn over to Wahida, who wears many hats, but just wanting to have you talk a little bit about what this work looks like through the lens of Health Not Prisons Collective, and tell us a little bit about what that collective is. And then if you can, share your experience with one of the Health Not Prison Collective's initiatives, which is the Justice Institute.
Absolutely. I'm so glad to be here. I apologize, my voice is a little scratchy, so I'll try to talk as clear as I can. So the Health Not Prisons Collective is a national coalition that's focused on de-incarcerating HIV criminalization. It's also focused on improving public health as well. For those of you who don't know, I just want to mention there are 5 organizations that make up this coalition called Health Not Prisons. They are the Sero Project, Positive Women's Network USA, the Transgender Law Center, the Counter Narrative Project, and of course, the United States People Living with HIV Caucus. Now, those 5 groups help to develop leadership development, political education, community organizing, narrative change, policy advocacy, and strategic litigation. The Health Not Prisons collective focuses on sustaining a robust intersectional grassroots HIV decriminalization response that centers us. That centers people living with HIV, that centers Black, Indigenous, people of color, there's certain people involved in sex trade, people who are immigrants, LGBTQ people, people with disabilities, and people with no income or people with low income. So we're talking about the people who are most vulnerable to HIV. This organization lifts these people up to be leaders. Now, I've been the interim coordinator for Health Not Prisons just for a couple of months. But I need to say that I consider this an honor and a privilege to be working with this group. The Health Not Prisons Collective is an amazing group of national organizers whom we as people living with HIV have come to know. We've come to trust them and rely on them to customize strategies to help educate our communities, and they insist on policies that work to protect our families and our communities. And we are very serious. Let me say this group is serious about ending the HIV epidemic. And if we are serious about ending the HIV epidemic, we're going to need to demand clear commitments to abolish any forms of criminalization targeted at those living with HIV and those most vulnerable to HIV. The work of the advocates everywhere, all of you all have worked to help do this, but we all of us here, the Health Not Prisons Collective, the Elizabeth Taylor AIDS Foundation, all of us together have been the catalyst to create this mechanism, this day of reckoning. I like to call it a day of reckoning, National HIV Criminalization Awareness Day. That allows the world a chance to stand with us and denounce institutionalized stigma and to expose that punishment as a public health strategy is the worst direction to go in. So the HIV Criminalization Awareness Day, it draws attention to the fact that we cannot effectively address the HIV epidemic without creating and enabling human rights and a human rights environment for people to live in. And I just want to continue by saying that the laws and practices that criminalize HIV are a form of institutionalized stigma, right? And we know that they're all, and when we talk about this criminal justice system or injustice system, the criminal legal system in our society, we know that these laws are enforced, they are enforced through racism, homophobia, and transphobic ways. So we're getting traction. I'm glad that we have this traction that we have now with having this awareness day so that we can educate not just our communities, but our legislators and also educate the judicial system. And so we have this grassroots when I say grassroots, I'm talking from the bottom up, right? So the Health Not Prisons Collective sustains and supports a grassroots we have this robust grassroots HIV decriminalization response that centers and elevates leadership of those most impacted. And I like to keep saying that because we're the experts, right? We're people living with HIV. We are people who are most impacted, and ourselves and our allies are impacted by these laws. And so we're elevating leadership amongst those who are the experts. And I think that's great. Now, I want to segue and just talk briefly about the Sero Project, the Sero Project's Justice Institute, right? And this started around this time last year, but it was designed to train and prepare some community members, the ones most impacted by HIV criminalization, to be leaders, right? And calling for repeals and calling for modernization of HIV-specific laws in their states. So the Sero Project began training this cohort. There's about 15 community members across the country, and including some of those from the southernmost states of the United States, to start building momentum and to start building infrastructure in their states, to start making these demands to repeal and modernize the laws. And I want to say it's always an honor and a privilege to help support and uplift new leaders and new advocates. And I was very, again, privileged to be one of the faculty members for the Sero Project Justice Institute, along with Kamaria, Tammy, Kevin, and some others, right? We also helped to develop an advocacy toolkit, which I believe is going to be also made public to you all today, the advocacy toolkit. Decriminalizing HIV requires an all hands on deck effort and determination. I'm a firm believer that the messenger matters. I'm a firm believer the messenger matters. And I strongly feel that those most impacted by those laws have to be central to educating our specific communities, educating our legislators, and again, the judicial system. So Sero Project Justice Institute trained, they trained people from different states and educating them to, I'm reading from notes, so I kind of lost my place. So I'm gonna jump over that and go here. So the Institute helped prepare the advocates to understand what it is to work in coalition with other folks. We have got them prepared to understand the values of intersectional grassroots organizing. We prepared them to take leadership, not just to be a follower, but to be in a coalition and how to take leadership within that coalition. And as the interim coordinator here now for the Health Not Prisons Collective, I have a chance now to reconnect and work with some of the cohort that I helped train last year. And I'll tell you, they are amazing. I'm really, really pleased. They are amazing. They're highly motivated, and they're determined to make change in the course of the events. So I want to end just by saluting all the work that's been done for so many years, bringing us to this moment. The work has been done by all of us. And I want to also invite those new leaders from the Sero Project Justice Institute that I want you to share equally in this victory. You know, I think that we have to know this fight doesn't end because we have a national day to bring about awareness of the atrocities of injustice of HIV criminalization. So now we take our fight. Now we take our fight for justice and fair policies. We take them to the next level. We take them to the federal level, right? But I just want to say simply, we just fight until we win. And as we fight together, we build character along the way. And I think that's more important. I think that's one of the most important things we get out of being together as a community and fighting is that we build character along the way. But this time we win. So thank you. I'm just going to stop there. Thank you.
Wahida, thank you so much. People in the chat are co-signing the Day of Reckoning, so that might become another hashtag to go with the Awareness Day. Thank you for uplifting the work that Health Not Prisons Collective is doing, as well as your role through Sero Project Justice Institute, which leads me to Nick, who is one of the Sero Project Justice Institute 11 participants who's been traversing with us. And I'm always transparent. It's been a learning curve for all of us, but it's been an amazing learning curve because the curriculum that we developed has also been additionally informed by the folks as they're in the session. They're like, you know, actually what will work better is if we talked about this, or actually if we worked better, it would work better if we framed it this way. This is what will go into this toolkit that Wahida uplifted, which is not being released today. The participants are still working on it. We want to release it today. We're very excited to have it ready for the community to utilize, but we just got to fine tune it in a couple areas. But Nick, if you don't mind sharing, what is the importance of this Awareness Day to you? How will this day support the work that you've done, what you've learned through the Sero Project Justice Institute, and how is that going to help you move forward in the state that you live in and the networks you want to be involved in to not just change laws, but to address discrimination and stigma everywhere?
Yeah, totally. I can't believe, first of all, it's been a year. I've even reading or listening to that bio, I don't recognize the person in the bio. I don't recognize that person because I think it was written before I joined the Sero Project. And I do finally feel like my voice is being heard, when I'm in meetings and on panels and everything, and people are actually listening to what I'm saying. And I know what I'm talking about, and I can finally like convey my point of view. And it took a very, very long time to feel comfortable in my own voice. And then I knew what I was talking about. And I like, and with the fellow panelists and participants in the Justice Institute, I'm reaffirmed every Thursday, every week. So it'll be really difficult in a lot of ways to leave, but I definitely feel stronger in that regard. And going forward, I just know, like, I just want to, to use a, trite phrase, perhaps, I just want to pay it forward and keep finding pockets of, emerging advocates and situations where I can uplift people. And even in terms of just like the day-to-day of my own life, I, went out for a job at my new ASO and I got the job. I'm going to be a patient access representative, which it means that I'll be like the first person that new clients and current clients see. And so I will have a direct interaction, and I'm just so excited of where that could lead.
Congratulations, Nick. That is super exciting. I knew about that before you told us, but for everybody else in the room, I can't give reactions as a host. So if you all can, well, no, you all can't either. So we'll have to just show them some love in the chat, And I also wanted to acknowledge, Nick, one thing I've learned from you is Nick has this storytelling gift, not just from their personal experience, but just observing and then like wrapping it together in a story. And I believe that that's something else that contributes to the power of awareness days, and being able to utilize that skill set to drive home the issues that Wahida lifted, and how Malcolm has mentioned pushing through specific communities, your own personal community, and being able to uplift your personal story as well as others. So thank you so much, Nick, for sharing that. I still have not heard from Andre, so I'm very sad that we will not have him on this webinar. However, he did say that he will be a part of the launch day webinar, where we'll happily show his video and also hear from him on that day. But I want to kick it over to Tim, who served right beside Elizabeth Taylor. And I just wanted to ask you, Tim, if you can share with us, if Elizabeth were here today, how would you envision her championing criminalization reform? Oh, well, sorry. And what is a historical like story or anecdote about her commitment and your relationship with her that you can share with others?
There's no question that she would be all over this. I wrote some remarks. So if you don't mind, maybe I can just read my remarks as they are. Sorry about that. But anyway, I want to say thank you for inviting the Elizabeth Taylor AIDS Foundation and me to be part of HIV is Not a Crime Awareness Day. We're excited about bringing additional attention to the issue of criminalization reform for people living with HIV and AIDS. As you said, I was incredibly blessed to work with Elizabeth daily for more than 20 years of her life. And while she was a world-renowned, award-winning actress, her role as an activist in the AIDS crisis is how she wants to be remembered. Elizabeth had zero tolerance for seeing people suffer. Throughout her life, she used whatever power she had to stand up for anyone unable or unwilling to fight for themselves. It's the exact reason she was compelled to speak out for people with HIV/AIDS. She witnessed thousands of people suffering and dying while the powers that be did nothing. She realized that she could use her platform to force the United States and subsequently the world to pay attention to the incredible injustice that very few people were willing to see. For Elizabeth, it was solely about taking personal responsibility to help marginalized people who were intentionally being ignored. AIDS was the most challenging situation Elizabeth had ever faced. Friends and colleagues warned her to stay away. I beg you to let this one go. Don't touch this, Elizabeth, it will ruin you, which all only fired her up further. Elizabeth definitely hated being told no. Elizabeth was compelled to join the fight against AIDS exactly because of the injustice. AIDS has never been simply a health crisis. It's a social injustice crisis. And it's exactly the reason she got involved back in 1985. Before Elizabeth knew that Rock Hudson had AIDS, before she found out that her daughter-in-law was sick from the disease, before she lost anyone close to her, Elizabeth stepped up and used her massive platform to speak out about AIDS, to force Ronald Reagan and the rest of the government to pay attention and to make sure that the public could not keep their heads in the sand any longer. She had a massive spotlight on her, and she knew that if she stepped in, if she went on that stage, if she spoke out, that the coverage, because of who she was going to have an enormous reach. In 1987, Ronald Reagan had barely uttered the word AIDS, let alone address the issue, but Elizabeth knew him from her studio days. She knew where he came from and was not about to let him get away with ignoring AIDS. Elizabeth went after Reagan relentlessly and finally shamed him into giving his first speech on AIDS at a fundraiser in DC. And when the audience booed him for his policies, she stood up for him too. Not for his unjust policies, but for the fact that the President of the United States finally showed up. And in 1992, at the International AIDS Conference in Amsterdam, when asked what she thought about President Bush's AIDS policies, she replied with, "I don't think Bush even knows how to spell AIDS," and made headline news around the world. From the beginning, it was the injustice that Elizabeth was fighting against. AIDS has always been a disease like no other because it had come up in the gay community. Because it had come up in the gay community, people were willing to look away. They didn't want to know about it. We all know that. Criminalization reform shares that same injustice. Outdated laws that are being used to unfairly criminalize marginalized groups, the same groups that Elizabeth fought for in the beginning. With many situations, it's impossible to know what Elizabeth would do if she were still here. But in this case, it's clear that she would be all over this, using her huge platform and political connections to speak out against outdated laws that are being wrongly used to imprison innocent people. As an officer of the Elizabeth Taylor AIDS Foundation and an individual accountable for Elizabeth's legacy with over 20 years by her side, there is no doubt in my mind that from wherever Elizabeth is, and I strongly believe she is here, she's extremely grateful to Kathy Brown for leading this charge from our end. Proud of her foundation's work, proud of all of you and all the work that you're doing, and would be using her own determined voice to be bold and active in this campaign. Elizabeth felt strongly, so strongly, that every human being deserves a happy and healthy life. Thanks to all of you for your dedication and hard work, and thank you again for having me here today.
Tim, thank you. I'm gonna stop sharing so we can see each other as panelists. And if Malcolm, if he's able to come back, can. I really appreciate, Tim, you sharing Elizabeth's allyship and how before she was personally impacted, before she knew she was personally impacted, she still stood up. And I think that's an important message to folks that are like, well, it's not my lived experience. I don't know anybody that has it. What can I do? Show up. I call this, and forgive me for my language, but I'm a transparent person. I call it having to give a damn. Like, you need to give a damn. And if it's not about directly like changing the laws, how can you support the people living with HIV that are doing the work? How can you amplify their work? Can you share an email? Can you host a meeting? Can you put pressure on federal agencies and the White House to, speak up? So thank you for sharing Elizabeth's commitment and the fact that she never took no as an answer. It's one of the things that inspires me so much about her. I'll accept no if you can make it make sense, but if you can't make it make sense, then I'm going to fight against you. So I loved hearing that. So thank you so much for sharing that. I do want to also kind of just open this space up for like a more open question that anybody can take, as well as folks that are watching on Facebook Live and joining in on the chat. The theme of this inaugural Awareness Day is to strengthen, to engage, to reform, to overcome. So how do we continue to strengthen advocates? How do we work to engage in the communities that we maybe haven't into meaningfully yet? And by that, I mean like our sex work advocates. There's a gap in that community of coming together to, when we're changing these laws, to not leave sex workers behind. How do we continue to reform these laws and overcome challenges that many folks have already faced in the states that have changed laws? As Malcolm mentioned, some of the challenges they're facing. Virginia was successful in making their modernization and are now going to go back and hopefully address their felony charges. So how do we do these things, right? What tools are needed for this? And how can this Awareness Day, in your minds, contribute to that important and critical work? I feel like the momentum, like it's now. Like our president, Joe Biden acknowledged criminalization on World AIDS Day. And we had success during a pandemic of laws being changed. Like during the time when the world stopped and people were scared for their lives for a whole nother virus, people were still able to make change. How do we keep that momentum? How do we move forward? And anyone can take that answer if you've had time to think about it. And anyone in the chat at this point, if you want to raise your hand, I can try to figure out how to take you off mute so you can speak. Feel free to share, because I would like for everyone to daydream in the world of no criminalization laws.
Yeah, so Maria,
Go ahead, Malcolm.
Yeah, so I'll jump in real quick. And I think, the one thing that I think we can do is to stop talking to each other. We tend to preach to the choir, but I know right now that if I walked into a barbershop in any Black community in Atlanta and said that, HIV should not be a crime, I would get pushback. And we have to be able to train our advocates to deal with those arguments, because we know that once they know the law, once they know the science, once they know the not having the ability to transmit, that some of those hearts and minds are going to change. Not everybody, but some of them. And so getting out there in the street and having that, having those conversations with people, I talk to my brother-in-law, I talk to people in my family all the time, and I make them aware, and they go, "Oh, I didn't know that." So, it can happen, but we've got to stop talking to each other.
I agree. And I just want to just jump in and say that we speak a lot about educating our communities, but I find that, and I do a lot of community presentations about HIV criminalization. I find that I'm informing. Our communities don't know. They don't know this is happening. They don't know that people living with HIV are facing criminal felonies. They don't know that. And I find that when we talk about the themes for this Awareness Day, strengthen, engage, when we engage them, right, they begin to call out the discrimination. And I go to a lot of shelters where people are very vulnerable to contracting HIV, or maybe people who do sex work, or maybe people, who are at risk. And we go there and we get that pushback, Malcolm, because people all know they all know about they all know about it could be what do they call it, what they say we're killing people, what do they say we're doing, attempted murder. They know, they call that out. But once we do our presentation and give them a chance to call it out, once we give them information, they become allies. It's like happens like right in front of our faces. Once we give them this information, they start saying that's discrimination. They can't do that. squatted, and then we have them align themselves with us, and then they help us fight. So we have to continue not just educating folks, but putting the information out there, informing our communities that this travesty is happening.
I really agree with everything you said, Wahida. And I'm thinking, like, Malcolm, when you brought up the barbershop example, I'm thinking, like, when is the last time when I got my hair done that I talked about HIV, but I didn't talk about the criminalization laws. And like, I live in a somewhat small town, so like, folks know what I do. And one of two things happen: either people completely avoid me because they don't want me to bring it up, because I will. um, but I try to read people to see where they are. And now, Malcolm, you even challenged me, like, there's a saying with an initiative we have here in Florida, Sisters Organizing to Survive, to educate where you live, work, play, and worship. And of those spaces, I'm always told like how courageous I am and how brave I am for telling my story. But then when I want to talk about the issues, it kind of like, blah, 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 like people pat me on the back and send me on my way. So thank you. I'm gonna dig deeper and try, because that's emotional labor. But I appreciate you bringing that up, and Wahida for reminding us all of like how deeply important it is to not talk to each other.
Yeah, and you know, the other thing is, I'll just say this real quick. I think what you guys are doing at Sero with the Institute is important, because there are strategies and techniques. Just walking into a barbershop and saying, well, hey, you know, sometimes that might not work. You might not have you might need a little bit coaching of how to deal with that and how to deal with the pushback, because, you know, then the next thing you know, you're in an argument and you're turning people off. So, you know, if we can get together, you know, one of the things that I'm doing with the guys at Thrive is with our Persona Academy this year is trying to formulate, okay, learn how to tell your story and learn how to educate folks by telling your story, not just going in there and fighting, you know, we got to stop this. You know, that's not the way to do it. So yeah.
I wonder, Tim, you know, it would be interesting to hear like how Elizabeth, and maybe in her smaller community gatherings of like friends and colleagues, how did she have those challenging conversations? How do you all at Elizabeth Taylor AIDS Foundation have those conversations amongst your peers?
Oh God. Well, Elizabeth had a very loud megaphone. So people knew already, you know, I didn't see her have to go one-on-one with somebody, but I think it's just the nature of how her life worked. You know, obviously she was in a privileged position, which she used, you know, to help. But, you know, in those early days, I only went to work for her in 1990. So in those early days, I wasn't around. So those early days is when she was getting like pushback, but she was, you know, she was so strong and so in her own power that people maybe weren't gonna, you know, once she committed to it, tell her, you know, I don't know. I just think it's so different. But I really appreciate the idea of, you know, because, you know, I love storytelling and I work on storytelling for our organization, but the idea that you can't just go out and shout, you know, I think that was such a good point. It's so tempting because there's so much emotion, but to find a way to tell it through, you know, through your own story or anyone's story, you know, and there's really certain things that you just need to hit on in order to get people to hear it. Because when you just hear, you know, AIDS, giving somebody AIDS is illegal, you know, it's like that sounds like, well, yeah, I mean, that sounds right, but obviously it isn't. You have to understand all the details of it, and it's just a complicated issue. So really, examples are great, you know, real life examples are great, but I think there's aspects that just need to be covered. You know, the times when the person didn't even seroconvert, you know, when it's saliva. It's a joke.
I really appreciate you for giving us that insight, and also raising the issue of like, you're so like when you have the knowledge, when you hear how things are problematic, you want to scream it from the rooftops, like HIV is not a crime, like this shouldn't be criminalized. I know that's how I felt when I first came into this work. I think it was 2015, and I've been diagnosed since 2003. I had never knew about the laws. But to Wahida's point, I heard people in the community say, well, if you give somebody HIV, that's attempted murder. Like, I didn't realize people were talking about criminalization. We just weren't naming it as criminalization. But in the community, they're talking about it, but it's from a standpoint of like a cautionary thing. I really appreciate everyone's weighing in, especially in the chat. I'm trying to keep up with reading it and keeping my thoughts to the comments that our panelists are making as well. I do also want to acknowledge that we're close to the hour, and I do know folks need to drop off. So I'm going to share my screen again to share some highlights with you about the Awareness Day. And before I do that, I just want to thank the panelists from the bottom of my heart. Like, thank you so much for making the time to be here and talk through this today. If folks are on and they're like, I've never heard of HIV criminalization, I will apologize. That was intentional. We didn't do a HIV criminalization one-on-one because this is an awareness day, and we want you to lean in and ask questions to want to learn more, which is what I will share with you next as I get with these Zoom buttons. Oh, Zoom fatigue is a thing, y'all. That's going to be like a medical diagnosis soon, and that worries me, but sorry, I'm rambling. Share at the bottom. Okay. And then here we go. So moving through some things, there is a goal, there is a call to action for you all. The Awareness Day isn't until February 28th. And this has been the kickoff to that Awareness Day. We wanted folks to have time to think, plan, explore options, and know that this year, 2022, may not be enough time for some folks to get a whole thing together in a month, but there's still something you can do on a smaller scale. And we feel that folks are armed and ready to join in the commitment and to continue to declare HIV is not a crime. So there is a sign-on letter that we're asking individuals and organizations to join in on today. And it's just stating your commitment to declare HIV is not a crime. And there's a list of activations within that letter of different things you can tap into, like reading the federal policy agenda called Demanding Better, which is written by people living with HIV. It has been a very powerful tool that folks in communities have used. We're wanting our Awareness Day events to show that over 100 organizations and 100 individuals agree that the time is now. And I will say that 78 people registered for this webinar. So we were almost there. And if everyone on here now can do this sign-on letter, I think one of my Sero friends is dropping the link in the chat, I hope. If folks can sign on now, you can sign on multiple times as an individual and any organization that you are an authorized representative of. And we want to be able to announce how many people signed on during our February 28th webinar, which the time has not been determined yet. So save the date, mark your calendar, and a registration link will come out soon. We've already said that the White House has acknowledged that these laws are outdated. Our EHE funding plans have pillars installed to give local jurisdictions opportunities to create programs and initiatives that support addressing and ending HIV criminalization. This day, this Awareness Day, which I think this is what helps it stand out from other awareness days, will hopefully lead to creating more collaborative opportunities, including funding that can be allocated to people living with HIV and state-led grassroots efforts that meaningfully engage and support those on the ground that are engaging with legislators, coalition facilitation, because a lot of folks that are running these coalitions are working full-time jobs and then hopping on a six o'clock strategic planning call, and then hopping over to a legislators meeting the next day. So having support and facilitating the coalitions and designing campaigns that can drive more awareness and other opportunities to bring awareness and activate stakeholders to end these laws is something else you're committing to through this sign-on letter. This Awareness Day is a living, breathing activation of space created just for advocates like you to cultivate calls to action, calls to accountability, the day of reckoning, as Wahida has said, and calls for awareness, even in states that have already changed their laws, even in states that don't have HIV-specific laws. And even in communities where HIV may not be the priority issue you're facing, but one of the fires you're putting out, this Awareness Day is also for you. As we mentioned, there are some tools that are in development, and we would love your support on finalizing them. There is an advocacy social media toolkit that's being drawn up that has specific hashtags, which I think are, I apologize, I'm skipping ahead. Yes, they're at the bottom here. So as you're sharing with us, you can use those hashtags for the different events that you're doing. And we would love to have a call for a 2023 Awareness Day committee to help plan for the next year. Again, thank you to everyone who has been on. I would like to close out this call with just reminding folks that National Black HIV/AIDS Awareness Day is coming up. There's some events in the community around the nation that are virtual. I think one of these might be in person. And a couple of these two events can be found on everyblackbody.org, which is a body of Black leaders that are answering the question, what does the response to HIV look like when led by Black people? They've put together kind of a National Black HIV/AIDS Awareness Day resource hub. So these two events are part of that. Again, everyblackbody.org. And there will be another space for this conversation to talk more about the HIV is Not a Crime Awareness Day on February 2nd with our Sero community conversations, and that'll be at 6:30 Eastern. And then we have a couple more events, one by our Sero Project Justice Institute participant, Tana Pradia in Texas, who is killing it, and will be having a voting and criminalization in Texas event on February 7th. And then of course, our Black United Leadership Initiative will be having a HIV and Black maternal perinatal care event talking about breast and chest feeding and the intersection of criminalization in that space. And I'll be moderating that as well. And then lastly, we have, well, I'm sure there's more events. Lastly, we also have on February 8th, Leisha McKinley Beach will be talking about prepping our people, a conversation for Black women about PrEP. So everyblackbody.org is where you can find the link for most of those events. And then there should be bit.ly links for these two events. Also, if you have another device out, you can take a picture of the QR link and that will register you for the Bully event. And we'll also be sharing these slides out later on. And I would like to just hold space for folks. I'm personally willing to stay on for 30 minutes just to talk to people. So I'll be stopping sharing my screen. I know folks have to drop off, but I will stay on to chat with you all in the audience. And if panelists want to stay on as well, just to get folks' reactions and conversation about the Awareness Day and what came up for them in this time together. So thank you all again. And this is now just open discussion time. And I will stop sharing. And if my co-hosts folks could help promote people to panelists. And I apologize if I didn't give those instructions earlier. And thank you for everyone in the chat as well. Thank you to folks on Facebook Live that have been participating and sharing out the slide deck, the link to the event.
Do you want everyone promoted, Maria, or wait until they raise their hand?
Which is easier? I think we can do hands raised. Yeah. Yeah. Oh, thank you, Nathan. I didn't even see who all was in here. And there are folks that are saying they have to go, Tammy, so we might not have questions at this time. I'm seeing people drop, like 20 folks dropped off. We'll give it just a few more moments. Tammy, was there anything in the Q&A?
No, there was not.
And I was trying to keep up with Facebook.
And there were no questions on Facebook either.
Okay. And I know everyone's messaging saying they're excited about the February 28th kickoff. So if you want to be a part of that planning, hit me up because I haven't planned it yet. We just know it's on February 28th. But as far as the registration link and the conversation and the flow of that, if folks are volunteering to speak, come at me. I see you in the chat, so I'm going to be contacting folks that said they're excited.
Alicia, just to let you know, all of the links, I shared it on the Sero Project Facebook page, but we will also include all of the links in a follow-up email with the recording and slides.
And for folks that don't know, that's the voice of Tammy Hott, the managing director at the Sero Project.
Yeah, I just want to just jump in and just say for folks who, everybody's not vocal, but a lot of people write. So feel free to write blogs, use our hashtags, use your social media to denounce injustices everywhere. Give a donation. There are a lot of ways that you can help without having to be on camera. For some people need that. Some people are just background helpers. So we want background helpers and we want front runners. So there's a place for everybody here to be a part of this. And I think this has really been people seem to be really excited about the information that we gave them today. And we just want to find ways that you can carry this information over into your own social media, into other spaces where you have a platform at. So, yeah.
Thank you for that, Wahida. I think that's something that's critical, that I know folks that are leading these coalitions and state networks don't always have the bandwidth, the capacity, or the skill set to put that together, or the support. Like one person might be doing all of the writing and they need somebody to edit, and then they need someone to push it to media outlets, especially if it's op-eds or things that you want elevated. And I think that's another thing that kind of stands out from this awareness for this Awareness Day. We have so many awareness days as people living with HIV. Like there's one for every demographic, right? And I think this one helps folks not have to fight through the noise of the other awareness days, because they're all important. But we get to stand apart and say, on this day, this is what we're prioritizing, and this is what we're talking about. And you can absolutely do that through blogs, your TikTok. I think there are a lot of people on TikTok talking about HIV is not a crime. And op-eds and things of that nature. So thank you for lifting that as another way of activating if you're not one of those front runner people, which no one believes me when I say that I am a behind the scenes person. I am not a front runner, but no one accepts that when I say it. Did Nick, Tim, did you have any closing thoughts about the Awareness Day and the future of the possibilities of the Awareness Day that you wanted to share with us? Not to put you on the spot.
I just was gonna say to what's coming up for me is just where you start is not where you're going to end up. I keep feeling that for myself, because even with points that you brought up and Malcolm brought up, I was sort of stigmatizing myself in terms of not getting tested and not like going in to get it taken care of, because I didn't know what was going to happen next, right? And so it was so unclear to me like what was going to happen like on the journey, so to speak. And so I don't know, I was so afraid and full of fear. And so I just want people to just know that they will find community and find their own place like within this work, and that this Awareness Day is a great place to start, and that people will be there to support you and uphold you, and you're not alone.
I'm really glad that you said that, Nick. I was looking through my Facebook photos because I was looking for something else, and I found a picture of you and I at HINAC, Indiana. And I think I had just done a session. Was it Indiana? It was one of the HINACs. And I had just finished a session. And I don't remember all of the conversation, but I remember your emotion of how you felt. And I'm just thinking to how that conversation was then, seeing you as a Sero Project Justice Institute graduate, soon to be graduate now, and then just envisioning the possibilities of where you're going next. What you said is very, very on point. Where you start is not where you are going to end up, because you're definitely not where you were when I first met you. And I can say that for a lot of advocates. I mean, there's folks who met at HIV is Not a Crime Training Academy for the first time. I think Cedric and Deirdre like met at one, and then the next, as soon as they left, they were holding meetings, and then they're in Virginia and changed their laws. So working together and learning together is definitely possible. And this community never lets you do anything alone. You're always supported and uplifted. So thank you for amplifying that.
No question.
Yeah.
Yeah, I mean, I think that's one of the things that's so great about this is, it's a huge, alliance of people. And I really think that just learning the information and talking about it at parties, as one of Elizabeth's messages, like everyone can do something. And, because I go to things and I'm not talking about it, or I don't always talk about the Elizabeth Taylor AIDS Foundation and the work we're doing and fundraise, but I know that should be part of everything I do. When I meet new people, I do talk about Elizabeth, and I do talk about it a bit, but in terms of straight up like having an agenda. So I think that making sure that we all know what we need to know to be able to lay it out in a really comprehensive way, and it is just a matter of right and wrong. This isn't right, and it's pretty simple in terms of that part of it. But I think we need to bring it into our hearts. Sorry, not to sound, I don't mean to like be that guy, but I do. I think we have to bring it into our heart and like have the feelings behind it, and then the story. And how we're going to address this, and how we can raise it with people that might not always be open to it, but you really have to understand it. Once you understand it, it's super easy to see why it's so wrong.
I have seen the narrative or the mindset shift when folks have no idea about the laws. I think that's the workshop that Nick and I were talking after. I had done a workshop that causes a narrative shift. That's not, my goal is not to change your mind. It's just for people to know why you believe what you believe and just own it. And what usually happens is people realize, like, I have no idea why I held that belief, and now my whole mind is messed up. So when you put that in the frame of HIV and HIV criminalization, I love to just make people think. And sometimes it's just a simple conversation, but it's also like doing it in a safe and brave way for people to feel vulnerable. Because one thing I've learned in this work doing community education forums is, especially with my peers, especially with like people living with HIV. I remember one of the first times I start talking about the laws, and I'm going through my slide deck and I'm like, Ford does this and we have this, and I'm looking at the faces and I'm reading the energy, and I'm seeing people process their diagnosis, and they're processing the time they did disclose, the time they didn't disclose, the time that they got in a really horrible, violent relationship. I'm seeing people process all this because they're sharing it with me. And I realized, like, it's more than just informing. You have to create space for vulnerability. So now whenever I do workshops, I try my best. So if people out there, if y'all email me, you only want me to come in for an hour to talk about this, I beg you to understand why I really like to have at least an hour and a half at minimum, because this conversation, every space I'm in can go on. Tonight won't, but it can go on for a very long time. But when you're introducing that first time conversation, you really got to give people an opportunity to wrap their heads around it and really sink their teeth into their personal reaction. Really glad.
Say goodbye to everybody.
Thank you so much.
Don't say
Yeah,
goodbye,
so
just say
long.
so long.
I'm still here.
Thank you. See you later.
Thank you so much, Sarah.
And I think we can actually, since no one raised their hands, I see people are just joining on the chat and affirming what we're saying. Hey, Lapina, I'm just, again, transparency. I saw your message. I just haven't had a chance to respond to connect to that connection, but thank you. Publicly thanking Lapina Reed, amazing, amazing advocate in Florida. And thank you to everyone who's been a part of this conversation. Wahida, the legend, Nick, the up and coming advocate that's going to tear his state up. And future, Sero Project Justice Institute participants. We haven't announced when we're having it, but please stay tuned. And future, attendees of HIV is Not a Crime. We don't have a venue yet, but we're working on it. There's a whole corona out there, so we're trying to navigate that. But meanwhile, while you're waiting for announcements and places to plant yourself into the work, please take care of yourselves. Please stay hydrated. Please hug your loved ones when you can. Tell your loved ones that you love them. I'm sure these past 2 years have shown all of us that life is incredibly short. And we just must appreciate it while we have it. And I have to say, I love all of you. Thank you so much for joining in on this, and have a beautiful and powerful evening. Bye.
Thank you, everybody. Stay safe. Thank you.
Bye.